decided at about age 8 that I wanted to be a doctor. And I can't tell you exactly what all went into it at age 8. I'd done some thinking, talked to my parents, and I finally settled on that. I lived in Ohio, southern Ohio, in a little town called Yellow Springs. And it actually was a very good school system, but I got bored, and so I skipped some grades and basically took the 12 years of school in 9.5 and got my high school diploma and entered Harvard when I was just 16. After Harvard, University of Michigan Medical School, and of course that's 4 years too. After the medical school, I went to Seattle, which was one of only 3 places in the United States at the time. Remember, this is 1969. It was the only one of 3 places that had residency internship in family medicine. Now there are over 70 programs, but at the time, just 3. The one here was the only one in which the students got to be in the outpatient clinics as well as the hospital. And I knew one thing, and that was that family doctors didn't spend all their time in hospitals. So I applied out here to the program that was under the auspices of both Group Health Cooperative and the University of Washington. While I was in the internship residency program, there were 2 individuals who came in as patients who showed me that there really were other things than what I had learned in medical school, and that there was actually a fairly huge gap in my education. One was a woman who had used every drug you could think of, including, of all things, calcium, which isn't a drug, for her leg cramps, and none of it had worked, and she had to take doses of quinine that made her ears ring. You know, quinine will do that if you take enough of it, and that barely controlled her cramps. So she came in to see me with a book and asked me, did I think it was safe for her to take vitamin E? Now remember, this is 1970 or 71, and there had been all this propaganda about how if you take too many fat-soluble vitamins, you might die. And so she was scared. But the book said that vitamin E might help leg cramps. So she just came in to ask me if it was safe. And I told her the one thing that we'd learned about vitamin E in medical school, and that was the only thing we'd learned too, was it wouldn't kill anybody. So she might as well try. Well, she tried it. Called back about 5 weeks later, said she'd flushed all the prescription medications down the toilet. She hadn't had a cramp in 3 weeks, and she was very happy with her vitamin E, thank you. So I thought, gee, I think I'll get a copy of that book. And just put it on the shelf. I had a lot of other things to do, didn't study it. Next time somebody came in with a problem that wouldn't go away with all the drugs and medications that had been used, I thought, well, what the heck, let's look in the book. And it said vitamin B6 might work. So I told her, didn't think vitamin B6 could hurt her. Go down to the health food store, try it out. She did. Same thing. It helped all her problems. So at that point, I decided that book might know something. Very fortunately, it had all the footnotes and references and citations. So I took it up to the University of Washington library at the medical school, and that's where I learned there was this big hole in my education, because the book was all about things that they had not taught us about in medical school, namely diets and vitamins and minerals. Funny thing. So I started collecting all the material I could find on solid scientific research having to do with diets and vitamins and minerals and herbs, and started finding out that, wow, those worked when they were applied appropriately, of course, and they didn't hurt anybody. And not only that, they were less expensive than prescription medications. The experiences with those folks were between 1969 and 1972. I then worked on the staff as a staff physician of the place where I'd gotten that education, Group Health Cooperative, for another year till 1973. At that point, the chief of staff and I had a little disagreement about 2 things. One, I didn't think it was responsible to see 12 children per hour and certify that they were all healthy. And they disagreed with me about that. And secondly, I had had someone with a non-healing diabetic ulcer use some zinc, and the ulcer healed after 8 years, and I was called on the carpet for using zinc because it wasn't approved. And I asked, what was the point of what we're here for? Was it using approved things or getting people better? And there was a discussion about that. And between those two things, I thought it was time to go start my own clinic. That started in 1973. And the first book that I wrote came out in 1979, you're right.